Welcome to SCR CONNECTions. Thank you everyone for joining us. It is my pleasure to introduce our guest speaker, Dr. Jerreed Ivanich. As a member of the MLA Indian community of Alaska, Dr. Ivanich is dedicated to health research for North American indigenous populations. Dr. Ivanich is an assistant professor at the Colorado School of Public Health, Centers for American Indian and Alaska Native Health, and an adjunct assistant professor at the Johns Hopkins Bloomberg School of Public Health, Center for American Indian Health. His work meets at the intersection of prevention and science, social network analysis, and adolescent health. Through community-based participatory research, Dr. Ivanich aims to take the knowledge and strengths of communities and put them in dialogue with the broader research field to improve public health and advance scientific methods. In today's SCR Connection, Dr. Ivanich will give a presentation on learning from American Indian and Alaska Native communities during the COVID-19 pandemic. Thank you, Dr. Ivanich, for being our guest speaker this morning, and I'll return everything over to you.
Thank you so much for such a kind and nice welcome. Let me go ahead and share my screen so that you all can join me in the presentation. I'm excited to be with you all today. Let me go ahead and just switch these. There we go. All right, so I'm not able to see a ton of the comments or chats, but I'm hoping that we can collect those and have a good discussion at the end. And I'm excited to be with you all today to talk about this really important topic. Far too often, what we end up talking about with American Indian Alaska Native Health tends to be very negative focused. And so what I hope to do today in our discussion is to kind of highlight some of the burdens and disproportionate health inequities that American Indian Alaska Native communities are responsible to bear at this moment in time, but also highlight their resiliency, their strength, their culture, and what we can learn as medical and public health officials in this space to really benefit and improve health for not just American Indian Alaska Natives, but other communities of color and also just the community writ large. So I'm excited to be here to talk to you about that today. So as mentioned, so I don't know if you guys can see this on this small little red dot down at the bottom. That is my home reservation, Metlakatla Indian Community. It's in Southeast Alaska, about as far southeast as it gets. And so oftentimes folks aren't too familiar with Alaska geography, but it is the last reservation in Alaska. That in and of itself is a long discussion that we could have, but a lot of political history there. But I'm excited to be here with you all today. And so in terms of our agenda and what we'd like to talk about, also throughout this presentation, I've kind of thrown in some pictures of my home reservation in Metlakatla to kind of show you the beauty and kind of demystify Alaska and how beautiful it really is. So this is just a picture from Metlakatla. But today we'll do a crash course in a population overview. We'll also talk about health services and statistics that are pertinent for American Indian Alaska Native communities. We'll talk about their resilience. So I kind of mentioned this and alluded to this a little bit earlier, but really specifically as we talk about COVID-19, what are the lessons that public health and medical officials can really learn that's taking place in American Indian Alaska Native communities and apply it elsewhere? Because I think that there's a lot that tribal communities are doing really well that we would all benefit from learning from. And then I'll also end with a little bit of shameless plugs. If this topic interests you, I have some information about where you can get some more information. So we got some of that looking forward to. And so I can see here in the chat, I've got it open on the side, or not the chat, everybody's thumbnails. So I don't know if you guys can do reactions, but how many of you have had a high school or college course in American Indian or Alaska Native Health? Like by reaction, thumbs up, or, okay, I see a couple raised hands. Okay, so not very many, that's okay. It's pretty typical. What about a course in American Indian, Alaska Native, anything? It doesn't even have to be on health. Like if it was legal or if it was environmental health. Okay, I'm seeing a couple of couple of thumbs ups. That's good. Some high fives, or I think those are high fives. That's great. Okay, cool. And then what about at least 4 hours total in school on the topic of American Indian, Alaska Native, anything, like ever? Grade school, something. Okay, I'm seeing some good thumbs ups. Okay. So there's definitely some folks that are raising hands and showing me some of those reactions, which I love and I appreciate to see. Kind of helps me understand a little bit of who I'm talking to. But also what I'm seeing is the vast majority of folks just have not had this kind of exposure. And that's no fault of your own. Oftentimes American Indian, Alaska Native populations, especially health, is just left out of the conversation in all curriculum. And so I'm excited to talk to you all about that, but I hope that as you were looking around too, you saw that there wasn't a ton of people. So we approached this topic with some humility. We approached this topic understanding that we're starting at a foundational level. So I hope that you all enjoy this journey with me as we kind of do a crash course. And so what I like to do, far too often, I feel like there's this disconnect. I think there's well-intentioned, really great folks out there that want to be great allies to American Indian, Alaska Native health, but oftentimes feel like they have, because of that lack of education that we just highlighted, sometimes they feel like they lack the ability to be a good ally because there isn't a lot of content, because there isn't talked about in school. Sometimes folks feel like even just the terminology of what to say. Do I say American Indian? Do I say Alaska Native? Do I say Native American? Do I say Indigenous, right? I feel like sometimes that can be a low bar to entry, but sometimes that bar still keeps people from entering this discussion and entering this space. And so I put these definitions here for us to kind of reflect on, but I also want to highlight that I do work in many different American Indian, Alaska Native communities. And I will say that because there are so many different tribes and communities, you don't see one group all unanimously adopt one name or one nomenclature, if you will. So if you're in a community and they call themselves Indian, while that's not a term I would typically use, it's also my place and my positionality that I wouldn't disagree with them or fight with them or have that conversation as a guest in their space. So I think as long as what we are doing is being humble, respectful, understanding, taking cues, and also openly admitting when we don't know something. So if you don't know, it's okay to ask. I can assure you that American Indian, Alaska Natives, Indigenous folks here in the United States, they want to talk about these issues. And so if you don't feel like you know the right word, throw one out there and say, but I apologize if that was the wrong term. What can I do? Is that the right term? How can I? And I think we could all move forward. And so this is my unwarranted, unauthorized blanket statement to you all to say, approach it with humility, and I give you permission to talk about this, if you will. I think folks far too often feel like they can't because they don't know, but it's okay. We'll learn together. And so again, looking at Indian country today, again, that term Indian country is largely a legal term. So if you're talking to legal scholars, they're going to be thinking about Indian country and they're going to talk about it in those terms. Whereas in a lot of public health, medical officials wouldn't necessarily often call it Indian country, but that's okay. So we can learn together. But if we're thinking about Indian country today, we would look at and we would see that there's about 6.6 million people. That's 2% of the population, depending on the estimate that you're getting. There's 574 federally recognized tribes and over 100 state recognized tribes, right? And then if we look at some blanket statistics of American Indian, Alaska Natives, there's about 20.7% that lacked insurance in the United States compared to about 9.4% of the rest of the US population. So definitely some work to be done in that space. And then also this data is coming from 2016 and 2015. So there's some numbers that need to be updated here. But as of 2015, 26.6% of American Indian, Alaska Natives lived in poverty compared to the US population at about 14.7%. So definitely some stark comparisons and data to be showing. And then continuing on, this really shows you that how many American Indians and Alaska Natives live in the United States. And so when you look at this, even this is a bit outdated. This is 2010 census. The number of federally recognized tribes has gone up about 8 since then, 574. But back then there was about 2.9 million percent, which is just under 1%, that indicated on the census that they were American Indian Alaskan Native alone. And then there was about 5.2 million that indicated that they were American Indian Alaskan Native in some combination, like myself. My father is white, my mother is Native, right? So on the census, I show up as one of these 5.2 million folks, right? And then also something to highlight here is the urban-based population. About 3.6 million of American Indian Alaskan Natives reside outside of the reservations, right? There are folks like me that live in Denver that don't live on their ancestral homelands, right? So some key takeaway messages. So we see some small numbers here, but it's one of the largest and fastest growing populations in the United States. And then also more than half of them, a large portion of them are categorized into this multiple race. So as we're doing our statistical analysis, as we're looking at data, we need to be really kind of cognizant of and thinking about who is this other group or who is this multi-race group and where are they coming from? And then again, as I mentioned, about 70%, depending on the estimates, 70 to 80% of American Indian Alaskan Natives are urban dwelling. So it's very diverse. There's 574 federally recognized tribes. So when we talk about American Indian Alaskan Natives, we tend to talk about them as one group. So there's 574 federally recognized tribes, and then there's within differences within tribes. So it's a complex area that needs to be addressed, but it also needs a certain level of humility and understanding that we can't talk about them all the time as one group. And so then some health disparities of American Indian Alaskan Native populations, just to kind of bring us with kind of a bird's eye view of health disparities in American Indian Alaskan Native populations. We see that the US infant mortality rate by race. So you can see here that it's the second leading group in infant mortality in the United States. When we look at mental health illness prevalence right below that, we can see some really, really stark and troubling information and data about mental health in American Indian Alaskan Native communities. And then we can see here percentage diagnosed in the US with diabetes and heart disease by race. So if you look at diabetes on the left, you can see, again, American Indian Alaskan Natives take a lion's share of this percentage, and it's extremely problematic. And there's a host of reasons for it, and we'll be addressing some of that. And then also heart disease, something that is has gone down in the past decade or so, but continues to be one of the leading causes of death for American Indian Alaskan Native populations. And then also, so I spend a lot of my time doing suicide-related research among adolescents. And so I wanted to point out some data here. So while we see a lot of public health concerns really reducing, so obesity, diabetes, heart-related issues, some cancers, right? We see some of these reducing over the past 10 to 20 years, which is great. And that's a good public health effort, good efforts by the medical community. But what we're still seeing are some of these issues like suicide continuing to grow year after year. And I don't have the data presented right here, but I can assure you that this data hasn't plateaued or completely ended up to this point. So we see these rates have risen even to this day in 2021. So hopefully more effort will be taking place to address these issues. But then also something I also really want to point out is this kind of potential twin epidemic here in the United States, especially among American Indian Alaskan Native populations, is this, I'm not going to call it a causal relationship at all, but there's a lot of effort to really understand what are the nuances between these two, because we see such a highly correlated trend of opioid-involved overdose deaths and suicide among American Indian Alaskan Natives. So definitely some work to be done there, because there's it's kind of a black box at this moment. We don't really know what's going on, but there's some folks really doing some great work to understand, is there some correlation? Is there some causation between these two that we should be addressing jointly instead of between the two independently in silos? And so I throw all this data at you, and I'm kind of talking fast. I'm throwing a lot of information at you and I apologize, but there's a lot of information to cover here. And so, I've established some of these major health burdens that American Indian, Alaska Native populations have to bear. But when we think about, well, what are some of those causes, right? And so I think if we're not taking a historical approach to understanding current and contemporary health, we're doing a disservice to the populations that we serve. And so I think when we look at historical trauma, colonization, displacement, removal, right now, I'm teaching a course in this one topic, right? An entire course on what are the causes of public health concerns for American Indian, Alaska Native health. And we spend a lot of time talking through historical trauma and colonization. And there's a history of federal policy designed to eliminate, assimilate American Indian, Alaska Native families and cultures that have really been hit hard. And so, when we talk about things like boarding school, removal, assimilation policies and efforts, those all have very, very damaging effects for American Indian and Alaska Native populations. Another big area that we spend a lot of time in my class talking about is treaties. So in lieu of land, they were guaranteed health, education, food, and shelter. So those lands have been given to the United States. It's gone. American Indian, Alaska Native populations no longer occupy that land. Yet they were promised health, education, food, and shelter. And as you dig into the data and as you dig into the issues, you'll quickly find that the health institutions that have been established, namely the Indian Health Services, and education, food, and shelter efforts that have come out of these treaties have not been what they were promised. So while that land was given as promised, the treaties have not been upheld. And then ending on somewhat of a more positive note is thinking through tribes as sovereign nations. So what can these tribes do as sovereign nations to really advocate, empower, and improve their conditions? And I think as we discuss a little bit more, particularly about COVID, we'll see that sovereignty really coming to play to be a huge asset to American Indian and Alaska Native communities. And so when we also need to think about the psychosocial influences and social determinants of health, right? And so when we look at the boarding school era, there was a long period of time where American Indian, Alaska Native children were taken from their homes and sent to boarding schools with the promise of a better future. And the motto by the individual that's kind of pioneered this space, Captain Richard Henry Pratt, he was known for kind of famously saying over and over again at each boarding school opening and at large events, and as kind of his mantra back to the US federal government, his saying was often kill the native and save the man, right? And so what we're talking about is cultural genocide, right? And so back then, I think Captain Richard Henry Pratt thought he was doing a really amazing thing. Like he was actually quite progressive for his time, thinking like, oh, well, we can educate them. They can serve a cause, right? Like that was a very radical idea in 1890, right? But it still was a horrible, horrible thing that was done without consent, without permission, without consultation, and really thinking long-term. It was very short-sighted. And so you can kind of see these pictures that depict American Indian, Alaska Native community members, these children that were taken from their home and forced to kind of assimilate, forget their language, forget their culture. And so I don't want to dwell on this too long, but think about the multi-generations of stress that come from this, right? So folks are taken from their home. They're no longer with their family support networks. They're forced to learn a language. They're forced to assimilate to a different dress. They're forced to feel embarrassed about their culture. But once and if they do graduate, they go back to the reservation because at this time, they're not really allowed to be productive members of the general population here in the United States. They were still very much so oppressed, stigmatized, and not wanted anywhere else. So they'd go back to their home reservations, yet they feel embarrassed. They don't know the language anymore. They don't know the culture anymore. They don't know the dresses and the ceremonies anymore. And so they kind of don't fit in either space. And then they go on to have kids. And so you can see how this is a chain of stressors, and trauma for multiple generations that live on today. This was not that long ago. And so as we continue to think about these causes, we think about the social determinants of health again, looking at education levels of American Indian, Alaska Native populations. So percent without a high school diploma is 17.8 compared to the US population. The percent living in poverty, 21.3 compared to the US total of 11.3. And if you also look at the median household income at 38,367 compared to the US total median household income at $53,046. So don't want to belabor these points. I know it's feeling a little bleak and dark right now, but I'm hoping that we're turning this corner here and thinking a little bit more about what are some of these causes. But I think it's important for us to address these causes because we can't be ignorant to them. We can't be naive to them, if you will, in the true sense of that word. We have to understand the history. We have to understand what's happening here. And so another huge issue, healthcare, if we look at the United States and we think about the United States and who has the right to medical services, oftentimes it's kind of met with a pretty bleak understanding that very few people in the United States have a right to healthcare, but American Indian, Alaska Native populations have a treaty right to health services through the Indian Health Services and other federal per capita health expenditures. But you will see down here, as of 2012, the Indian Health Services per capita spending is about $2,849 for all of the American Indian, Alaska Native populations. And you can compare that to how other dollars are being spent in the United States here. And so I got my bachelor's and my master's in criminology. So I don't put this statistic here to suggest that federal prisoners don't warrant the kind of spending and per capita health expenditures that we're seeing here. But it is a bit shocking to see that Indian Health Services, who have treaty rights to healthcare, don't actually receive the same level of healthcare as incarcerated populations and other sources of health expenditures like VA or Medicaid that you see here. So this is another huge reason why folks don't have coverage, is because IHS runs out of money fairly early on in the year. And so I'm going to kind of switch it all up. I hope that was a crash course in kind of some of the major concerns and areas that public health and medical officials are really thinking about and wanting to do work around for American Indian populations, and some of the causes around those. But now switching to thinking about COVID-19 specifically and what's happening this past year for American Indian, Alaska Native communities. And so there's a big asterisk here because as we all know, things are changing on a daily, weekly, monthly basis. So take what I say with a grain of salt and know that things are changing rapidly. But some data that the CDC presented and have published is that American Indian, Alaskan Natives are about 3.5 times that of non-Hispanic whites to be oh man, I'm losing my words, but to have COVID-19 and to have serious illness and mortality because of COVID-19. Cases significantly higher among individuals younger than 18, which is unique for American Indian and Alaska Native populations compared to the rest of the United States. And then there's less cases, which is a positive note, there's less cases among those 65 and older. And I have a hypothesis on that, and we'll get to that here in a second. And so we have to think about what are some of the environmental, social, cultural implications for COVID-19 for our Indian country today, right? So why would we see rates 3.5 times higher, right? And so we have to understand, as I pointed out earlier, there's underlying health conditions that are particularly problematic for COVID-19, diabetes, obesity, heart issues, right? So we're seeing that as a huge environmental and individual risk factor. Contact tracing difficulties. So oftentimes when you live in rural reservations, contact tracing can be extremely difficult, especially when there's high turnover rates of cell phones and nobody has a landline anymore and internet's difficult to get a hold of. So it's really hard to kind of do contact tracing. Transportation Um, Again, it's really hard to get people to hospitals. Oftentimes when you live 2 hours away and it's rural country roads to get to the hospital, if you just have a bit of a cough, you tend to stay home, but then that escalates really quickly and you're not getting the care that you need as quickly as you need. We talked about poverty. Another big one, multi-generational households. So we know that a lot of American Indian Alaska Native families live together. So it's kids, parents, grandparents, all living in one house. And so there's a lot of chance for kind of within household transmission. Healthcare system, we just talked about the Indian Health Services and how woefully under budget they are to serve everybody. And then also thinking about historical trauma and how that translates into kind of a distrust for guidance given by the federal government in terms of wearing masks or some of the guidelines that the CDC puts out. Sometimes there's a hesitancy and reluctance to jump in and be full on with those recommendations because of how American Indian Alaska Natives have been treated in the past. And so I want to focus and kind of switch gears again and think about what are some of the resiliency factors of American Indian Alaska Natives during COVID-19 that we can all learn from. And so one thing that I'd really like to highlight is tribal sovereignty. So you'll see rates in places in South Dakota, in the Dakotas in general, and then in some other tribal communities where they enacted that tribal sovereignty and they set up checkpoints at their borders of their reservations. And unless you were bringing in essential services or essential goods, you were just not allowed to come through. And so when you compare their rates, some of those communities that exercise that tribal sovereignty for their safety of their people, you'll see that their rates compared to others like Navajo Nation, where it's just so geographically large and would be nearly impossible to kind of create that kind of border check system. When you compare those two communities, you'll see that communities that were able to do some and exercise some of their tribal sovereignty like this were able to greatly reduce the transmission of COVID-19 in their community and really stay fairly healthy compared to some other communities. And that's not the case for others. And there's also a long-standing history and politics and complications with this. And I believe as of this week or next week, many of these tribal communities are now being forced to end their checkpoints, even if they don't want to, by federal or other organizations. So it's complicated, but I just wanted to highlight how tribal sovereignty can act quickly and safely to protect their community members. And then also cultural values, right? And so I mentioned earlier that we see compared to the US population, we see that those 65 and older in American Indian Alaska Native communities are getting and dying from COVID-19 at significantly reduced rates compared to the US population. And my personal hypothesis and belief around this is it kind of comes down to some of the cultural values, right? Elders in communities, typically 65 or 55 and older, are revered and they are the knowledge keeper for communities. And so they're often protected. And so there's been a strong concerted effort by communities at a policy level and at individual levels to really try to do what they can to protect elders in their community because they are the language speakers, they are the traditional knowledge keepers, and so there's been a lot of effort to protect them. And then also thinking about food sovereignty, right? And so I think this pandemic has really made folks kind of anxious, a little worried about going out to the grocery store sometimes, and really made us think about what we're putting into our bodies and what's healthy for us. And I think that this has been an effort that a lot of American Indian Alaska Native communities have been calling for quite some time, is a need to return to traditional foods and traditional food sovereignty about how they grow and take in food. And I think we can learn a lot from sustainability practices. We can learn a lot about health practices and how we can be better localized response to issues like a pandemic, where getting out as an elder to a grocery store became a lot more difficult, especially if you live on a reservation and you can't have your food delivered to your house like I can. And I'm assuming many of you can as well. So thinking about what does that mean and what can we learn from them to help in this space. And then also community. The communities are, there's just such a strong community aspect to living on the reservation and being part of that space. And I think it's really led to, so while I mentioned contact tracing can be difficult in some communities, I think some communities, like the White Mountain Apache community, has done extremely well at contact tracing. They were quick to garner resources to get the proper training and resources needed to actually follow up on this. So while you see that Arizona has some of the highest rates of COVID in the United States, and while the White Mountain Apache tribe has not been exempt from that, and they've also seen similar rates of COVID-19, if not slightly higher, their rate of mortality because of COVID-19 has been significantly reduced compared to the state. And that's largely because they're contact tracing so heavily in these communities. And so while people are testing positive, they're being told, they're being given information and education of how to best address these issues early on, so that way they don't become major complications, and so that way they can get the health and safety that they need. And so folks are surviving because of that, and I think that's an amazing thing. And so I think there's a lot that we can learn from American Indian Alaska Native communities on how to address this pandemic. So things like contact tracing, like I just mentioned, community engagement. How can we really make vaccines, as we're talking about vaccines now, how can we engage community members at a true integral part to really avoid vaccine hesitation and get people into that? Understanding high-risk populations and the governance around those, I think American Indian Alaska Native populations have done really well. And then also thinking about things that we can be doing on a policy level. So thinking about the importance of data. So while Native communities have sovereignty of their data, how can we better work and partner with them to make sure that that data is available in response times like the pandemic, where we can really monitor and create policy programs and efforts to really help folks instead of it kind of being in the dark, and improve healthcare systems and a host of other things that we've already talked about. And so moving forward, when we think about data, as I just mentioned, there's a lot of issues around sovereignty that we need to have those discussions around that data and what does that mean. But I think at the heart of it is, how can we as public health or medical officials be better aware and suited to actually address some of these data issues with respect and with understanding of that sovereignty, so that way we have less misclassification, so that way we have the ability to respond in real time. Resources, right? So I'm an adjunct with the Johns Hopkins Center for American Indian Health, and I've been so blown away at their response to the pandemic and being able to get resources out. And so instead of just staying in their lane for research, they've really been able to marry that research support with resources and advocating for Native communities to bring hygiene products, masks, water, hand washing stations, portable hand washing stations to communities that need it. And I think we need to be mindful of those things. And then as we're now thinking about vaccines, how do we prioritize that? And so again, thinking about that tribal sovereignty, many of these communities were able to set their own guidelines of who was going to get priority for these vaccines. So if you think about like the Cherokee Nation, they prioritized their language speakers as some of the first to be able to be eligible for the vaccine, because that language is so vitally important to them as people and to their identity and to their culture. And so they prioritize that. And many communities are now offering 16 and older open vaccine for anybody in the tribe, right? And so they've really, really taken it on. And if you haven't seen some of these reports coming out, the New York Times wrote, I believe it was New York Times or CNN wrote an amazing piece about the vaccine rollouts in tribal communities and how they've been able to do it so efficiently at such a local level and really do it in a way that has protected the most vulnerable, and how they're moving into those non-vulnerable populations so quickly already compared to the states. And then we need to do more to address the professional workforce. So we need to do more on bringing in more public health scholars, more doctors, medical doctors, and the like that can actually be responsive in these times. And so I've got a couple of slides here. I'm going to go ahead and just go over this real quickly, just for the sake of time, and kind of switch into, on that note, about really kind of this is the part of the presentation of my shameless plug. I appreciate you being patient with me, but I think if we're going to improve that workforce and that workforce of ability, we need to have educational opportunities for community members. And so I'm the director of the Certificate for American Indian Alaska Native Health at the Colorado School of Public Health and the Centers for American Indian Alaska Native Health. And so I love this proverb: tell me and I'll forget, show me and I may not remember, involve me and I'll understand. And so this program that we've developed, this certificate program, really hopes to engage and get people involved in the spaces that they occupy. And so instead of it just being a program for folks that can go, there's only 2 other programs in the United States that are like this, and that's at Johns Hopkins Center for American Indian Health, and then also one in North Dakota, I believe. But both of those are in-person programs, whereas in this certificate program is completely online, so that way we can reach folks who do live in community, but still want to have that educational opportunity to get certificate programs and possibly go back to get a MPH or on to medical school. We can give them that resource for as long as possible in their community. And so these efforts are really being led by some faculty at the Centers for American Indian and Alaska Native Health and the Department of Community and Behavioral Health. And so these are some of our buildings, though students in the certificate program will never actually even have to come because it is online. Like I mentioned, the only other 2 programs are here in North Dakota and in Baltimore. And our program is in Colorado, which is much closer to so many of the Native communities, but then also it'll be online. And so when we think about why will it be online, we hope to extend the reach to many different community members that can't leave their community because they're serving and they're helping and they've got a family. We're hoping to be able to reach them and provide this space. So if you guys all know of someone that may benefit from this type of program, please keep it in mind. But it also provides flexibility for working professionals, and it generates creativity through multimedia learning. So this isn't just come and watch me stand in front of a bunch of people and talk at you like I've been talking at you all today. And it's a 15 credit hour program, 3 core courses on American Indian Alaska Native courses. So there's Foundations of American Indian Health, that's taught by myself, Ethical Considerations in American Indian Alaska Native Health, taught by Dr. Kaufman, and then Social Determinants of Health by Dr. Brega. And so there's a lot more to come, but I hope that this presentation was a brief insight into kind of what that overall certificate program is. So that way, if you enjoyed this all and you know someone that wants to work with and partner with tribal communities, this may be a valuable resource to them. And these are some of the topics that we'll cover. And so when we think about who should enroll, obviously I think everybody should enroll, but more seriously, I think practitioners and organizations who serve American Indian and Alaska Native people, researchers interested in meaningful discovery with American Indian Alaska Native communities, and educators teaching about health equity. I think that needs to be more encompassing, and we need to be more inclusive. So I want to leave some time for a discussion. So I appreciate everybody's willingness to kind of go with me through that very rushed presentation, but I hope it provided some insights. And I see there's been lots of comments and information put in the chat that I haven't been able to respond to. So I'll go ahead and stop sharing my screen, and hopefully we can have a discussion about this. And I don't know, Edward, are you fielding those questions, or how do you want me to approach that?
Yes, I'm just gonna share my screen again, and then I will start to ask those questions to you.
Sure.
Thank you for that wonderful presentation. So we'd like to now open everything up for questions while everyone is gathering their thoughts and typing them into the chat. I will just start with some of the questions that's already been placed into the chat. And the first question, we'll just work backwards since you just talked about the certificate program. So I want to ask, how long does it take to complete the certificate program?
Yeah, it's a great question. So it's designed to be a one-year program. So we hope that you start in the summer or you enroll in the summer, and then by the next summer, you're completely done if you're able to take the courses kind of as prescribed, but it is online. So if you need extra flexibility, that's also built into the certificate program if needed.
And the next question, someone asked, what's the cost to acquire this certificate?
Yeah, so there are tuition costs associated with that. We are working tirelessly right now. This doesn't launch officially, so some of these classes are being offered right now, but the certificate program doesn't officially launch until next summer, so summer 2022. And so we hope by then that we'll actually have some earmarked dollars and scholarship opportunities for a selective cohort of folks. So if it is of something of interest, please connect them to me, and I'll continue to work with them as those details emerge. And if we can get folks resources, we definitely want to.
And the next question, who are covered by the Indian Health Service?
Yeah, that's a great question. And so Indian Health Services does cover anybody that is a member of a federally recognized tribe. There are other opportunities for Indian Health Service clinics and hospitals to take on other folks. And, especially in this period of time where so many of these tribes are not that are contracting themselves to build out and offer these services, they can change how that looks. But if you're going to a strict IHS facility, federally recognized tribe, but that can change depending on your location in the area. So if you're in Oklahoma and you're in like the Cherokee Nation, because they serve such a diverse and heterogeneous population, they often take kind of anybody and everybody because their population is so diverse. So it's a complicated question, but that's kind of the boiled down version of that response.
The next question, in the South, I know usage of amphetamines is higher than opioid usage. Is that data also captured in overdose information somewhere?
Yeah, no, I think that's really, really spot on. There are major regional differences. So opioid use in the Southwest is just not nearly as big of an issue as like methamphetamines. And so it's definitely regionally specific. CDC does have some of that information, though the classification, misclassification issues are something to be really cognizant of and take a big asterisk of understanding when you approach these topics, because the data isn't always particularly clean, but it is something that folks need to be aware of.
Can you talk a little bit more about, or can you talk about the forced sterilization process? I saw some comments and some things in the chat about that process.
Yeah, so that was a really dark period of time for so many Native American people. So forced sterilization really, it's estimated that 1 in 4 Native women were forced to be sterilized at this period of time. So if you look at census data from 2000, I'm trying to remember off the top of my head, I believe it's 1960s compared to the 1970s, I believe it is. You'll see that while white or non-Native family sizes increased tremendously, you'll see between those two periods of times that Native family sizes decreased significantly. Many Native women didn't know what was happening, and this was also happening, I will have to say, in Indian Health Services. So this wasn't some nefarious, doctor on a rampage, right? This was the Indian Health Services, the organization designed to help and support Native communities. Oftentimes, the doctors and the practitioners in those spaces were non-native because of other historical reasons, right? But they were doing these under the directive of a higher administrative to sterilize these women without their knowledge, without their consent, without being able to tell them in their first language. And so many women thought that this was almost a form of birth control. And so when they would come back to the clinics and they would ask, like, okay, what's the medication I need to now have a family? The doctors would be forced to tell them, you cannot have a child. So, and so I saw some comments in here about hesitation for vaccine. And so I think punctuated periods of time like that and policies and actions like that by the federal government really, really do heighten this hesitation around vaccines because there is that history, right? And so that's why it's so important that we do things at a community level and really give tribal communities that sovereignty to address this in their own specific, unique way. So that way the community members can understand the science and understand that this is happening for them and largely by them, is so important if we want to avoid vaccine hesitation in tribal communities.
So what steps would you, or practices would you advise or give someone as advice to try to reach that population, the tribes? Because if there's distrust with IHS, like, would you prefer or give any insight on how they could get inside to help the tribal community?
Yeah, so I think it's a difficult question. It's complex and it's different from community to community. Some communities are extremely ready, willing to work with allies that want to do good work. But you have to understand, if you're approaching this from kind of an outsider standpoint, it's going to take a little bit more sweat equity and time and dedication to it than someone like myself who can kind of come into a community, even if it's not my own community. I can say, I'm Alaska, I'm a member of the Matlakala Indian community, and that automatically gets me a certain level of trust and understanding of a shared common history and background that some others may not. And so when you approach it, it needs to be on their terms. It needs to be with cultural humility. It needs to be, and you have to know it's a long haul game. There's too many examples of kind of a lot of folks call helicopter research or helicopter medicine, right? Where you come in, you do this one thing and then you leave. But I was once in a community where they were talking about this concept, and a community member, an old elder, kind of raised her hand and she said, that sounds more like mosquito research, right? She said, because you show up, you bite us, you take our blood, you take the thing that you need for your own benefit, and then you leave, and then we're left here with either a disease or with, an irritation at the very least, right? And so we have to be mindful that when we work with communities, it may not be easy for that first period of time, but once you have that trust and once you have that relationship, community members value and love you. I don't want to speak too long here, but I think an amazing example of this is Dr. Matthew Santosham, who founded the Center for American Indian Health at Johns Hopkins. He's a non-native man who went there for medical residency, and he ended up living there for 6 or 7 years with his family. And while they were having a huge issue with diarrhea amongst their children, he was one of the leading researchers around oral rehydration and was part of the team that developed Pedialyte, right? And so that had a huge buy-in from the community. And so as they've had other things come up, like other vaccine issues and illnesses, so I believe 3 of the 7 federally mandated vaccines that children must take before entering school, where all the clinical trials were done under his leadership, in part in White Mountain Apache, because of that trust that they had built up with him. And then as other issues have come up, like suicide research, they've come back to that center time and time again because of that relationship. But it did require time, effort, and dedication, and a lot of humility on his end. So there's a long-winded way to say it's not easy, but I think once you get in, there's a certain level of trust that can be built.
And then we have time for one more question. And someone as in the certificate program, are there opportunities to work within tribal communities / populations?
Most definitely. So, while we're still a ways out from officially enrolling individuals into the program. At the Centers for American Indian Alaska Native Health, we have so many different research partners, and we also started a recent partnership with the medical school here on the same campus at the University of Colorado School of Medicine, specifically with their Rule Track program. And so there are opportunities both for those that are interested in kind of the more medical side of things, but then there are also just numerous opportunities, if possible, to engage in research if that's something that individuals are interested in, both kind of clinically and non-clinically. We really do hope. But then also there isn't that expectation if folks are working professionals in their community and they don't have time for that at that time, there isn't that forced expectation on them, but there is that opportunity if folks are willing and wanting that.
Thank you again for that wonderful presentation, Dr. Ivanich. It was a pleasure to have you with us today. If you have time, I'm pretty sure there will be some more lingering questions. So if you wanted to just go in the chat and answer those questions, I think that would be great.
Yeah. Thank you.
I'm going to stop the recording.